Hello, my fellow nurses. It's me again, your online nurse bestie, Funke Konjo-Jelade. Welcome to Oversabi Nurse, the number one hub for nurses who wants to love, learn, and level up their careers. Whether you're a nurse in Nigeria looking to move abroad, or you're already working overseas, this is the place where we keep it real, fun, and informative. Today, we are settling one of the biggest debates in nursing. Nurses in Nigeria versus nursing abroad. What's the real difference? To be honest, if you've worked in a Niger hospital, you already know how it is. There's the big difference, child. So we're breaking down 9 major differences: the pay, the work culture, the perception, the environment, the respect or the lack of it, and some of the biggest culture shock nurses experience abroad. Trust me, you don't want to miss number 7. So before we dive in, don't forget to subscribe to our channel for weekly content on nursing, immigration tips, licensing, exams, career growth, and real life nursing experience. So we start with number 1, salary and benefits. Let's start with Naija. Hey, you work from morning till night. Yes, you barely see it in your bank account. Entry level for nurses in federal hospitals or government hospitals is between 80 to about 150,000 per month. While most private hospitals even pay less. In terms of getting bonuses and paid leave is very small. You are even lucky if you get your salaries on time, or maybe there's strike and you can't get salary for 6 months. Abroad in UK, US, and Canada, entry level for UK especially is between 28,000 to 35,000 per year, while US is between 60,000 to 80,000 per year. Canada is also on the high side, and the benefit you get to enjoy: health insurance, pension plan, and paid time off and overtime pay. In Nigeria, one nurse can be assigned 50 to about 30 patients to care for, even though your shift starts 8 o'clock, because it's usually 8-hour shift. You end up working past your shift because you still have patients to attend to. You are known for giving injection, medication, and dressing wound and all that, and then you also become the psychologist, the doctor, counselor, and, they go sharp pack work for you, everything they'll give it to you. But in UK, US, and Canada, nurses handle 4 to 8 patients per shift, depending on where you're working. And they structure it to make sure you're productive, and your documentation is electronic, so you're not spending half of your shift looking for missing notes. Oh my God, in Nigeria, it's very glaring, because patients treat you like you are their assistant, and some doctors treat you like you are their secretary. They're like, nurse, can you write this? You give this, do that, all that. To make matter worse, some doctors see you as their secretary. So it's the other way around abroad. You are called by your title, you are called the respect, the professional respect that you deserve, and you also work independently, or you work collaboratively with other healthcare teams. And your opinion really matters in patient care. In most Nigerian hospitals, they're still having manual BP, and paperwork is also a thing. To make matter worse, there are times that there's even no electricity, there's no water, no steam, especially in government hospitals. Occasionally, you have to add a lot of creativity, to your nursing skill. Your creativity level has to be on point, because you can improvise for IV stand, it's very, very hilarious, believe me. However, in US, Canada, and UK, everything is digital. You're using automated BP machine, electronic health record, and proper medical equipment. So there's no need for you to manage, because you have everything that you need to do your job. Let's go to career growth and opportunities. This really hurts to say, but in Nigeria, you might need to have connection before you can get promoted. You have to know somebody that knows somebody that knows somebody before you can climb your professional career ladder. And your specialization options are very limited. It takes time before you get promoted. You can't even switch your specialization. It's really hard. So, but in abroad, it's totally different. You can specialize in so many departments: critical care, anesthesia, surgery, midwifery, and so on and so on. You get to determine how far you want to go at the peak of your career. Whether you want to become a nurse executive, or you want to be a nurse practitioner or a clinical nurse specialist, the sky is the beginning for you. You know, working abroad gives you that chance. Working hours and overtime. So in Nigeria, officially your shift is 8 hours. And you know, most of the time, either you work morning, afternoon, or night. In reality, you're staying way past your time, your closing time, while you're not getting paid for the extra hours. As for night shift, whatever you see there, you have to really improvise and you have to deal with it. And your complaints sometimes are not even attended to. So, but for abroad, you have your working hour is so structured to 8 hours or 12 hours per shift, and you're paid for doing overtime. And night shift, you get to get extra pay for night shift or shift differentials for afternoon. And then you don't just work tirelessly without getting compensated. You get paid for overtime. Nurse to doctor relationship. In Nigeria, some doctors actually see nurses as their personal assistants. You know, nurses that do this, do that, write this. You can't even have an opinion, you know. And if you question a doctor's decision, they give you that look. Yes, they'll give you or treat you like you're uppity or something like that. Meanwhile, you're just doing your job. Fortunately, this is not the case abroad. Doctors and nurses work as a team. You collaborate together because collaboration is key. And nurses can even challenge treatment plan based on patient observation or based on the history of the patient, because you know this patient. You're the one staying with this patient 24 hours because, you know, nurses stay more than with the patient. You know the history, you know everything. So if you see anything is off with the doctor's prescription or the treatment plan, you can tell the doctor and then you can collaborate on it. This particular misconception makes me laugh, okay? Many people think that nurses are the helper for doctors. Some will even be saying, why don't you become a doctor? Especially the male nurses, they have it really, really worse because they'll be asking them, why not study medicine? Why not become an engineer? Why are you doing women's job? You know, but in abroad, this is not the case. Nurses are highly respected abroad. In the US and Canada, there are nurse practitioners that can diagnose illnesses and prescribe medication. Nurses are seen as an important part of the healthcare professionals, not just as an assistant. Then job security and stability. You know, you cannot boast of job security, especially if you're working in a private hospitals in Nigeria. You know, you can get fired at any time. Some nurses even go months without getting paid. So government nurses have more security in Nigeria, but due to strikes and policy changes, that usually affect promotion, and that makes it even worse. So neither of the choices sound promising. Nursing is in high demand in the UK, US, and Canada. Once you pass your exams, you are almost guaranteed a job, except if you're picking and choosing and you're trying to be, you know, see, this is what I want, I don't want this. You know, there are endless opportunity growth for you, you know, abroad. There's travel nursing, career stability. You work diligently, you work efficiently, and you have peace of mind. The difference is really clear, my fellow nurses. There's better pay, there's respect, work condition, and career growth are all waiting for you abroad. The demand for nurses overseas is rising every day, and this is the best time to take that bold step. If you've been thinking about relocating, but you don't know where to start, we've got you covered. From licensing, exam, to securing your dream job, we'll guide you throughout the whole process. Don't just dream about a better future. You have to take action now and let Oversabi Nurse help you make that happen. So if you've worked in both places, in Nigeria and abroad, which one do you prefer and why? So let's share that in the comment below. Don't forget to like, subscribe, and share this video. And then we have more Japa content coming your way.